I want to or welcome to the stage Xavier Becerra, former Secretary of the U.S. Health and Human Services. In his role at Health and Human Services, he ushered in many changes under the Biden administration and the COVID-19 pandemic, which we'll talk about today. He's also the former Attorney General for California and a U.S. Congressman for more than 2 decades. So we are just so thrilled to have you join us today. Thank you so much. Thank you so much for joining us today. We really appreciate your time. I know you're very busy.
Thank you, Dr. Lyles.
So I set up a few comments. I'm sure you have many things that you want to do to react to any of those. But to get us started, I would love to hear your reactions to sort of the ABCs of policymaking, specifically as it relates to the scientific integrity campaign that I know you led under the Biden administration, and sort of what you learned or what you can share with us about how you would take a call for scientific integrity and how to implement that into an entire governmental program.
Well, first you have to sustain it, and this new administration pulled down the memorandum that had been issued by the president that called for scientific integrity, and they've changed it dramatically because they've almost made research the enemy of the good, because now you have to have almost perfect research before you can consider it applicable in our policy today. And it's a standard that I think most researchers would never be able to achieve. And so that opens the door then to using non-data-driven research in your policy making, which probably drives a whole bunch of researchers crazy, because you thought that everything you did was science-driven, and that science helped you generate the data that then help you inform policy, and it's been reversed. And now policy is dictating to the research, and it's unfortunate. So I'd say first and foremost, if we just stuck to our guns and did things the way we had in the past, which is to have data based on studies that are easily transparent, help guide us through this process, I think we would have been in far better shape. The other thing I would simply say is that if you're going to have data-driven, research-driven policy, you have to have a constant, rigorous subjecting of that line of thought to testing from not just internal sources, but outside sources, so you can constantly find out if you're still heading in the right direction.
I love that. So this sticking to our guns, sticking to the fact process, that leads me to sort of another question that I had for you, that maybe you could go give an example of that. In the time of the COVID-19 pandemic, there was the tension between the rigorous evidence and the need to act very quickly, often in the face of less evidence. Is there anything, as using that as an example to build upon, how you think to stick to our guns, or any pearls from that you think we all could take moving forward, and how we stick to our guns and stay true to what we're trying to do in evidence-based policymaking?
Yeah, that's very similar to the Apollo 13 failure is not an option situation we found ourselves in, when we had to come up with a quick solution, otherwise we'd lose these astronauts forever. Yet at the same time, whatever solution we picked, if it wasn't the right one, we might lose these astronauts forever. And so that's the dilemma you face. On COVID, mask or don't mask, require it or don't require it. Vaccines, effective or not effective? Are they good to stop transmission, or are they good to help you have less of an infection? Lots of questions, and at some point you get the fork in the road and you have to decide which way you're going. I would say that what you end up doing is, if you're good at the game, what you do is you require those who are advising you to give you more than one option. Don't just tell me this is the way we're going to get that spacecraft down to Earth. That's the one option. And if I go with it because that's all you give me, if it didn't work, well, we're in trouble. Why didn't you mention option 2 or 3? Give the person who has to make that call more than one option. And by the way, these may not be ideal options, because you're coming at them as quickly as you can without doing all the rigorous research to figure out which are the top 3, but you have no choice. Give me more than one option. That's probably the most important thing. And the second thing is, of course, make sure that the options you give have been, to some degree, tested. They have some rigor behind them, and they have some true data that support them. But don't just give me what, your anecdotal evidence. Give me something that's based on something I can touch in science, and then let me decide which of the three options is best.
I love the idea of giving more than one option. Just to build on that a little bit more, hindsight is always 20/20, but do you think that, in thinking back about how we communicated to the public about COVID-19, that we were clear about where we had the best evidence, where we had okay evidence, and where, do you think that we did a good job, or are there any pearls in there that how we could communicate those nuances, not just when we know yes or no, but when we're in the middle? Do you have any recommendations or ideas for a future emergency or for a future public health event, how we could communicate that differently to the public?
You all should start social media accounts because we are being swamped by those who profess to be experts who have never done the science, and they are beating you at your game. And that's the most unfortunate part. People are following some of the craziest things. I mean, there are still people out there who truly did believe that we were putting microchips into people by getting them injected with a vaccine. And how that ever became a controversy is hard to fathom, because who came up with that one? And more importantly, why would you believe it? Yet many people did. And so I think, I used to say this to my wife, Dr. Carolina Reyes, who's going to be on the next panel, who's a physician. I would always say to her, you guys have to reclaim your profession, because doctors are no longer dictating how we do medicine. It's the guys who know how to make money off of doctors who are driving how we do medicine. And wow, have they taken over. It's the same thing when it comes to communicating science, data, research. You aren't beating the other guys at the game in communicating what we know, and we're being swamped. And I do believe that the only way to counter that misinformation, that disinformation, is to have people who are trusted be the people who are out there first. And believe it or not, scientists aren't totally trusted the way they used to be. And so you may need that football coach to be standing next to you to communicate that message, that it would be a good idea for your kids to be masked up during a real contagious disease. But we have to figure it out, and we don't have a lot of time, because there are people who are writing stuff right now who have large audiences who have never done the science.
I love that. So social media campaign, getting out ahead, focusing on our trustworthiness is another part that I heard in your response. I think a lot of us in academia are worried that we're not good at those things. That
you actually aren't.
So it sounds like partnering with local trusted folks, getting some training or some skill building in communication skills, thinking completely different about how we think about science. Is that a fair summary? I would love to, if you have any other sort of things that you've been working on in your career, or things that we could take on as concrete steps that we could do.
Yeah, and let me give you a quick example. During the height of COVID, Dr. Rachel Walensky was the director of the Centers for Disease Control and Prevention. She's phenomenal. She is as skilled a scientist and doctor that you'll find when it comes to contagious diseases. She's done it all. She came from some of the best institutions. Yet because she wasn't able to communicate to, quarters of the country in why masking was important, or why you needed to get a booster, her trust level started to go down. She was communicating all the facts. She was communicating what the science and the data were telling us. But we were losing the game because she wasn't communicating in a pithy way. And it is so corrosive to watch how people can destroy character and diminish accomplishment. And so I think what we have to realize is that this is a different game now. Technology has taken us far, far beyond whatever most of us, when we were younger, thought we could do as scientists and as practitioners. But technology has taken this also out of our hands. And that's when as I said to my wife way back then, you got to reclaim your profession. you all have to reclaim your profession and be the ones that decide who the voices of reason are and decide what the data really show, or at least the data we should all be looking at. And I can't emphasize enough how you ultimately could be more trusted than the cosmetologist who decided to be a doctor. But right now, that cosmetologist is reaching way more folks than you are.
Yeah, I think that's something for us to really think hard about in academia. I think we're trained, sorry about that, trained to be right. And to not say anything that could be a misstep, get one tiny fact wrong rather than getting the overall narrative wrong. And so we pick it apart, and that's good in our profession. We want the peer-reviewed journal to be correct. We want all the errors removed, but it's a different kind of dialogue when you're thinking about what is the most important evidence that we're communicating. And then the second part of that I think I'm picking up in your response is the authenticity part of our profession as researchers and scientists, and being out there, being okay with stating the facts, and being, like we were talking about a second ago, being honest about where we know a lot and where we don't know a lot. And I think sometimes we think the public can't handle that level, but it's an interesting moment in 2025 to think about that, but I still think the way forward is to trust the public and the community with the real information that we have at hand. So I like the push to put out there more publicly. It's definitely not how we were trained, but something that I think hopefully all of us are going to take seriously if we're going to move our profession forward and regain the trust. It's not to be flashy, it's to get back to a level of trust that's necessary for our country. Yeah.
Can I just say here, pediatricians, unfortunately, we're slow to get out there and talk about how important vaccines are, and today it's tougher to get parents to want to vaccinate their kids. Pediatricians are still well respected. They still are fairly high, if not towards the top of the chart. There are very few people. They rank above clergy. They rank above most people, but their voices were absent when the talk about vaccines being dangerous or really not effective really started to resonate. And, you don't have to always be the most expert. You just have to be willing to talk to folks at their level. You don't want to speak to them as the scientist. You want to speak to them as the neighbor next door who cares about that kid that mows your lawn. And you really do care about their kids. And this is why you're giving them this advice. And by the way, I happen to be a pediatrician as well.
I love that. The second fact is, yeah, actually I'm an expert in that. Yeah, that's really great advice. I really hope we think about that as we go forward today. I want to switch gears a little bit and talk about sort of implementation of policies and sort of what happens after we make a program or a legislative bill is passed, and then we're rolling it out in public. I think another area of expertise that you have is thinking about the equity of what these programs and policies look like. So I was wondering if we could think about the opposite side of that. We've implemented a new intervention or program, and how do we stay true to ourselves as implementers to ensure that everyone is getting the same benefit from a program or policy that we got it to the finish line. We translated it into policy. Then how do we hold ourselves accountable about making sure it's actually doing what we wanted it to do?
And this is what we faced with the vaccines. I had been in the office for a few months. I was confirmed in March of 2021, and by May, June, when we were getting daily reports on COVID and infection rates and hotspots and the rest and distribution of vaccines, and by late May, early June, it was already becoming clear we were seeing the trends that we always see in the country. By early June, about 2/3 of white adults had received at least their first vaccine. Less than 50% of Black and Latino adults had received their first vaccine. You could see it already growing. And so to answer the question, I told the team, we've got an effective tool here, vaccines. It's just that we're not getting to everyone. We have to stop waiting for folks to come to us. We were doing the mass vaccination centers outside the arena parking lots, in gymnasiums and the rest. And I said, it's time we start going to them. And so that's when we started doing the smaller vaccination activities. We would go to the schools and say, can your coach let us join them, and after practice, where parents are getting ready to pick up the kids, say, hey, we've got vaccines here for you. And we don't say it, not the scientists, not the doctors. The coach says it. And those are the types of things that we did. I went to Salinas, California early on, and because it was so difficult to get our most essential workers, the folks who always had to go to work even though the infection was out there, people like farm workers, assembly workers, I went to Salinas, and working with the growers and the shippers, we finally got them to do vaccination sites in the fields. So the farm workers didn't have to leave the job, they could get vaccinated. And the growers loved it because they didn't lose a day of workers, and they got their workers vaccinated when everyone was getting infected. And what we found was in Salinas, in Monterey County, at one point, low-income folks like farm workers had a higher rate of vaccination than did middle-income and higher adults in the county of Monterey, something that never happens. But it became clear that financial interest of the industry were to get these folks vaccinated, and we were willing to go where they were. And so that's one of the things I'd say. The second thing I'd say is, well, we all know. You could take a look at this room, and I don't mean to offend anyone, but this room does not look like the folks who typically get sick or die, or typically aren't insured, or the ones that are the essential workers. We need to have more investigators, more scientists, more doctors, more clinicians who are going out there and going where they are that look like them. I remember we would get stories back from the South where in the black community, it was sometimes tough to get vaccination done in communities. And it was not that they were thinking they'd get injected with chips if they, took the vaccine, these microchips. It was that they would it was Tuskegee. There were bad experiences for a lot of communities when it came to the government peddling something to you for free. Because in those days, it wasn't in your interest. It was in science's interest, but not necessarily in those subjects' interest. And they were very skeptical about the government peddling something for free. And so you have to know your audience, and you have to go to them and then come with some trusted voices. And certainly, if someone looks like you, sounds like you, has your experiences, they're more likely to trust you. And if they're coming to you, even more reason why you feel more comfortable doing something that you're otherwise not too sure about.
I love that all of your answers are really based in people, it seems to be, in terms of how we communicate science person to person, how we implement policies and programs people to people, and really that's the way forward to be able to do this well. I was wondering if you had any other final comments. I mean, it seems like we've been trying to talk about that in academia, and now there's an attack on the words DEI, and just to say that very clearly, but when you think about it from a people-person perspective, to me, that is the real way forward to think about this. When we're thinking about what is a policy and what do people need, what do communities need, I think in academia, we need to really be centering that type of language, and because that's really what we mean when we say it. And I was curious if you think there's anything especially to learn in 2025 about how to do that implementation, given that there's clearly some attack on some of the words we were using to do this, and any other pearls that we could take to make sure we're focused on people at the end of the day.
Well, first we have to stop allowing people to co-opt the words that mean pretty basic, healthy things. I never knew diversity had a bad connotation. Darwin wouldn't have told you that. And so why should diversity be a bad word? Equity? Inclusion? Come on. Do we want to be an exclusive society? No. And so somehow those are bad words. But then again, as my dad would tell me when he was a young man growing up, it was a bad word to be Mexican because of the signs that would say outside establishments, no dogs, Negroes, or Mexicans allowed. And so, yeah, when you let those words take on a meaning beyond what they should, live with it. But if you do believe in those things, if you do believe in diversity, if you believe in inclusion, if you believe in fairness and equity, then fight for it. It's not a matter of being woke. By the way, I'd rather be awake than asleep at the wheel. And so But it's again, someone else is driving the agenda for us. Shame on us, not shame on them. Donald Trump is not my favorite, but we knew what we were getting. What I didn't expect is all those cronies around him who are enabling him to not just bend, but to break democracy. That's what's bad. When you've got people on the highest court of the land saying it's okay to profile Americans against the Constitution and the Fourth Amendment, that's serious stuff. Those are the enablers. Those are the bad guys. People voted for Donald Trump. I believe in democracy. I will accept the guy as the president. What I don't accept is that there are enablers allowing him to violate the law and do harm to all the people who we've been trying to uplift through diversity, equity, and inclusion. And so count me out of that game saying that I cannot say DEI, I cannot implement DEI. We're not Donald Trump, we're not Washington, D.C., we're California, and we get to do things differently.
That's a perfect segue into my last question before I want to open it up for a few questions from the audience, which is that I think a lot of people earlier in their careers are feeling down about evidence-based policy making and science, or down about focusing their career in equity. And I was, in both domains is my honest opinion in this moment. I was curious, you sort of talked about standing true to your values and staying true to what matters to you. What other advice do you have for people earlier in their careers or in their lives to make advances in this field?
Oh, gosh. By the way, I love that I get to talk to scientists and physicians and PhDs about your stuff, and I never studied it well. I couldn't get through chemistry. And I love that, because I have that title, secretary, or because I did a lot of work as a congressman or as an AG standing up for healthcare, I get to speak on these things. And you notice how I try not to go into your profession too deep because I'm veneer thick. But I do have experiences. And give me the question one more time because
just advice for these careers. These are your scientists. What would you say to them?
So right after the election in 2024, I went and spoke to, they were mostly health administrators, mostly hospital administrators, mostly in large hospital networks, public and private, for profit. And one of the first questions they asked me was, we're panicked. What are we going to do? And it was one of those, remember that movie, forgive me, I like to go to their instances in movies and books that I like to remember. What was the movie with Cher with the moon, something in the moon? Moonstruck. Mm-hmm. Moonstruck, when she approaches the guy she loves, but the guy is not willing to push hard because his brother is already offered to marry Cher. She slaps him across his face and says, snap out of it. Come on, wake up. You're about to lose me to your brother. And I love you and you love me. It was, it's a great moment. Snap out of it. So as these executives who probably drove up in nice cars, were dressed in really great clothes, and are going to finish their day running large institutions that save lives, are saying to me, oh, what do we do? We're so panicked. I said, essentially, I didn't say snap out of it, but I essentially said, look, you're going to go home and have a great dinner. You may have a glass of wine. You get to drive that nice car. You're going to see a great paycheck come through your portal on in your bank account pretty soon. Panicked? Panicked are the patients who have to go to your facilities who may not get to go through those doors this time. If you show you're panicked, how should they feel? It's like when you're the captain of the ship and you're in trouble, do you show to your sailors that you're panicked? No. That's when you have to be the strongest. That's when you have to lead. And so to each and every one of you who've got your PhDs or your MDs or whatever, and you've got the nice cars and you will have that glass of wine, you have no right to be panicked. This is the time for you to stand up. because there are families that are really panicked. There are families that didn't go into your clinics or your facilities through their doors because they're too panicked to walk through them, even though their kid is hurting really badly. And so as tough as these times are, unless you're just willing to cave, unless you're just willing to have somebody's social media drive what you do, this is where we stand up. This is the real test, right, of a democracy. And this is the real test of whether we believe that we can control our fate because it's based on science and data and evidence, not on some anecdote and not on someone's whim. And by the way, here's where I'm going to inject. If you haven't already voted by November 4th, please vote and vote yes. There's only one thing on the ballot. I'm not even going to tell you what the number of the proposition is. Just vote yes. And snap out of it. Let's snap out of it. Let's have a collective snap out of it with all our degrees and all our incomes. And let's figure out that we know how to solve this because there truly are people who are panicked. And we got to be there for them.
I love that. A wake-up call for all of us to wake up. I have more questions for the secretary, but I'm going to pause here. We have about 10 minutes, so we have mics in the room that we can walk around if there's questions in the room. So please raise your hand. And there's a question in the front and over in the back. And then we'll also try to look at the Zoom Q&A. So please do try to type in there if there's a question from our live stream audience. So I think, we'll go to Richard in the back, and then we'll come up here to Sergio. Yep.
First of all, thank you, Secretary Becerra, for being here. Reminder, Secretary, I think, grew up in Sacramento. He's one of our own. I want to make sure to mention
McClatchy.
Yes, McClatchy. So very proud to know that. Also, he hasn't mentioned it yet. He's running for governor as well. So I did have
your $20 comes after I finish here.
Yeah, right. This one's free. So Secretary, I guess one of the things that I want to ask you, and certainly you didn't really touch as much on your amazing work as AG as well, and I know we work together to address private equity and its impact and negative impacts on healthcare. What lessons would you take from your experience as being our Secretary of Health and Human Services to governing the state of California, right? We're part of this Western Health Alliance. We're pushing back against the lies and disinformation coming out of, unfortunately, Washington and the current secretary. What do you say are the things that you want to bring to the leadership of this state, and how would you want all of us to help you in doing that? The scientists and the doctors, pediatrician here, thank you.
Dr. Pan, or former Senator Pan, thanks for the question. And I do have to say, because when I was AG, I tried to run a bill. I was very active as AG with the legislature because I had served for more than 2 decades as a legislator. So I tried to run a bill that would essentially prevent Wall Street from gobbling up so much of the health sector as they are doing. And fortunately, Dr. Pan was one of those who was working with me. We came very close to passing that bill that would require that anyone who's trying to gobble up a facility, a medical facility, had to show that it would be in the interest of that community where that facility was located, would be served in some capacity. Either services would grow or they would improve. And so there had to be some purpose behind the taking over of that facility beyond just making money. We couldn't get that over the legislative hurdle we had, but we came very close, and Dr. Pan was one of the instrumental legislators to help us move that. Let me give you what I think is a good way to answer the question. So, actually, do me a favor, tell me, where would you want me to focus on that?
Yeah, I guess I would just say, what lessons would you take from your experience as being, our nation's Secretary of Health and Human Services to leadership of the state, given the current situation?
Got it. So there's 3 ways I can go, but I'm going to go only one way because we have other questions. So we suffered a $1 trillion cut to Medicaid. There's a very strong chance that the premiums under marketplace insurance coverage in the Affordable Care Act is going to balloon 100, maybe up to 200% for people, which means they probably won't keep it. And they will then become uninsured. So we are witnessing Washington, D.C. take us backwards when it comes to health care. what I would say to you is what California should do right now is make it very clear. We're not going there. We are not going backwards. We are on the precipice of actually providing access to health care to every resident of the state of California. I won't say it's all quality or the best, but it's still access, which is better than not having access and then having to use the emergency room to get the care you need when it's already late, more expensive, and more difficult. You'll understand this because you're in this field. Healthcare is not a commodity. When your child is hurting, you at some point will say, I can't wait any longer. I'm going to go get that healthcare. It's not like a widget that you need to get that widget for your kid. No, you need the healthcare because it is life or death. So you're going to get it. So whether you have insurance or not, whether you can afford it or not, you're going to get that care for your child. It will cost money. Someone will have to pay. And so why say to Californians, gosh, Donald Trump just decided to whack us $1 trillion and to allow the Affordable Care Act premiums to no longer be affordable. And so therefore we have to stop offering you coverage, which means you now have to wait and wait and wait before you take your child to see someone until it's so bad that you can't wait, and now you use the emergency room, which is the worst way to do medicine. As I think you showed, Dr. Lyles, we spend already way too much money. Okay, so here's the deal. I go to the health sector and I say, we're all going to do this together. That means you all have to tighten your belt a bit. And so if you're accustomed to getting 100% payment, Medicaid, Medicare, ACA, for that patient that just walked through your door, you're probably going to have to accept 90%, 85%. I don't know what the percentage will be, but a little less. But, and I will then guarantee as a state that they will come with insurance. So they will be paying customers when they walk through your door. You're only going to get 85, 90, whatever percent, but they're going to be paying customers. It's either that, so we all tighten our belts, or I have to accept that we just lost money in Medicaid, Medi-Cal here, and therefore a whole bunch of Californians are no longer to have Medi-Cal coverage. And therefore, what I'm telling you is they're still going to walk through your door, except they're going to come with zero payment from the state. What would you rather have? A patient who comes with zero payment, and therefore you absorb it, or you pass it along, or comes with 85% payment, and every patient who comes through your door will either be 85% or 0% that's under Medicaid right now. I think most folks in the health sector say, I'll take the 85% deal, because I don't think it's permanent. It's until we can correct this stuff, but we'll survive. Because I can't afford to have you close your clinics where most of these folks who don't have insurance first go. Because if they close a clinic, then they really will use the hospitals, which are the most expensive way to get care. And so this is a bargain that I have to make with the healthcare sector, but I guarantee you most of the sector will say, I'm in. Because the alternative is a whole bunch of charity care or charging insurance companies higher prices so you can compensate for the uninsured care that you had to give and didn't get compensated for, or you make the state somehow absorb it more through the public hospitals, which have to be funded through the counties, and they have to go into their budgets. It's not a good outcome either way, except one of them keeps the system doors open in many communities and gets the care in early, not late. And so we can get out of this mess. We just can't panic. We can't just throw our arms up and say, oh my gosh, this is the failure's not an option moment. And in California, we got enough money in this system. Dr. Lyles showed you in the chart, there's enough money. We can make this happen.
Thank you. Yes, right in front.
Thank you for being here, Secretary Becerra. On May of 2021, you came to Sacramento being the Secretary of Health and met with community leaders, both Latino and African Americans. And at that time, the mortality rates because of COVID of Latinos and African Americans, as you said, it was the highest in the state. And you met La Familia Counseling Services in one of the local churches, first with Latino leaders and then with African American leaders. And UC Davis was there. And you taught us, I remember vividly, how to listen to community members. You were listening actively. And not only that, I remember you saying, right now we have resources. Tell us how to have penetration, can reach out to this population so we can provide vaccine, we can provide antigen tests and vaccines. And we did that thanks to you, thanks to your leadership. So you taught us about meaningful community engagement. The other thing that I want to mention is that the recently released, well, not that recently now, of the Principles of Community Engagement, 3rd edition, you wrote the foreword. Beautiful piece, and I encourage everyone to look at what you wrote about it. So my question is, and you also mentioned when you look at the audience, and you said, look at the audience. No community members, perhaps. So you had been teaching us about meaningful community engagement. If you can share with us just a few pearls on how do you go about doing that? Where is that coming from? Because you already have taught us a lot.
So it doesn't hurt that, like Carolina, my wife, and I, we both went through circumstances where we didn't have a lot, and you had to sort of find out about things. But once you find out, it's like you're in a toy store. And there are so many families that would love to enter the toy store. And you just have to give them a chance to open the door. And wouldn't every family want to make sure their child is safe and protected from something as harmful as COVID or the measles? They just have to know how to open the door to the toy store and find out what it takes. And when I was here, that's where we were trying to practice the go where people are instead of waiting for them to come to us on COVID. And it really worked because people appreciate it. I got to tell you, one of the things that I would tell health clinic leaders most often is, thank you for having facilities, premises that look nice. Because when you're a patient or you're taking your family and you don't have money and you're relying on the people that you're going to go to in that center, in that clinic, to offer you care for free, you don't expect much. You just are happy you get to walk through the doors. But when you walk into a place that looks like you're in Beverly Hills, you feel like you're $1 million. And you feel like you're being respected. And that's all we got to do is let communities feel respected. And having someone that looks like them be the doctor, wow. You feel like you're on the top of the world. Having someone who not just looks like you, but speaks your language. My parents, who did fairly well for themselves, even though they were a construction worker, never had any education, college education. My parents, they had a doctor who my dad could rarely fully understand. My dad ultimately died of congestive heart failure, but he lasted a while. But my dad would always say to the doctor, when the doctor would say, "Okay, Manuel, how are you doing today?" "Oh, fine, fine, fine." And, you'd look at his legs, and they're swollen at the bottom. "You feel any troubles?" "No, no. Everything good?" "Oh, fine, fine, fine." Then he'd come home and, "Oh, me duele aquí esto." He'd come back and tell us all his ailments. I finally got him a doctor who spoke Spanish. He would not only tell him, "Oh, tengo aquí, estoy un poco," how do you say swelling in Spanish? "Estoy hinchado, un poquito hinchado, blah. Oh, me duele." And he would tell him all these things. And then he'd say, "Oh, and I just finished doing this work on this house," and the doctor would listen, and the connection was clear. Dr. Bermudez knew my dad, not just his health, he knew my dad. And my dad trusted Dr. Bermudez. Dr. Bermudez said, "Take that pill," he would take the pill. Dr. Bermudez said, "Go over the cliff," he would go over the cliff. That's what we need, is to gain that trust. And you gain that trust by doing very basic things. Show me a place that you really respect me and you're going to treat me like I'm a king or a queen when I know I'm not. show me that you count on me to respond because you come to me with someone I can understand. Very basic stuff. People don't ask for a lot. Let them into the toy store.
Thank you so much. Unfortunately, I think we have to move on to keep all of the agenda moving forward, but we are just so thankful for you to spend time with us today and to share your insights and to put the people first and to really wake up. That's what I'm taking from this talk today. So I really appreciate it. Thank you. Let's welcome,
Thank you, Dr. Lyles.
Secretary
Thank you.
Becerra.